Hi, Kendra.
Hi, Tina. Thanks for coming and helping.
Yes. So let me know what's going on.
Right now, I have a little bit of bleeding. My nipples are cracked.
Okay.
In addition to that, they're sore and tender.
Okay.
Yeah.
Okay. And how old is baby Leo today?
He's 4 days old today.
Okay.
Yeah.
Okay. And did he have any weight loss from the hospital?
He actually did, about 5%.
Okay.
Yeah.
Okay. Well, that's within range of being normal. So yay for that. So was he assessed at the hospital for any tongue ties?
Yeah, he was assessed, but it seemed okay.
Okay.
So.
Okay. That's actually really good news. That's fine.
Mm-hmm.
So a couple things I really want to tell you. So today is day 4, and this is commonly the day that we wake up and our breasts are rock hard.
Oh.
So very important that we relieve some of that pressure. So I want to teach you some things about how to relieve pressure and what may be workable, but also what's going on that your nipples are sore. So first and foremost, I want to talk about how you latch baby on.
Okay.
So when you bring baby Leo to you, I want you to align that nipple with his nose here, right? So as it's coming here, but rest your nipple here on him, and that gives baby Leo a reflex to open his mouth really wide like a baby bird, right?
Oh.
So as we do this, we wait for that really wide open mouth, and then we try and get up to 80% of that areola in the mouth, and that helps the nipple to move back to the soft area, which doesn't hurt us.
Oh, beautiful.
So if he's latching on just on the nipple, that it's going to hit a part that leaves a lot of friction. It's going to make you very sore. So you might notice too, your nipple might be misshapen or even white looking or very pink when he comes off. So that very important latch will help. So the other thing I noticed, that one, you're holding him beautifully in what we call a cradle hold. There is different holds. So if this were the baby's head, that would be the cradle hold, right? So we have another way of holding the baby that is called a cross cradle hold, where we're holding the baby under the neck and guiding with our fingers. So that allows us to support the neck and bring the baby, and also can free up our other hand if we want to use it to do some pressure here to help the baby to get more breast in the mouth. So when you first start feeding the baby, a couple things you can think of. You're very engorged right now, so you're very, very full, and we might need to relieve some of that pressure to actually get some of that softness where he can reach out or latch on, because when we're very full, that nipple tends to go in like that.
Oh, okay.
So we can do that by hand expression, which is, it's very easy. You don't have to plug anything in. It's very accessible. You can do it in the shower. You can do it anywhere you want, and just drip that milk right into a cup, even onto a spoon to feed back to the baby. What that looks like is we're going to make a C shape with our hand here, and we're going to put that on the breast there, right behind the nipple area. See? Because if we're pulling here, this isn't actually going to give you much milk. You might see a few drops, but the milk is stored back here in the breast. Right? So when we take that, if it were me, I would take my hand and put it here. I would push the breast against the chest wall, and then I would apply that pressure and move forward. Right? So I'm guiding the milk forward this way. So it is important that we put that breast tissue back so we can really identify that sinus that's holding the milk back behind there.
Okay.
So we talked about the latch. We want to get 80% of that into the mouth. We want to make sure how you're holding him. So when you're going to feed him, some things are very important, is that you want to line baby up. So ears, shoulder, and hip are straight. It's hard to swallow when we're twisted, right? Okay. So, and I see you doing it right now, which is perfect. I'm going tummy to tummy. So smooshing that baby right into you is really going to help him feel safe, and it's really going to help him feed the best. So don't be afraid to smoosh his body into yours. You're leading with that nose. So what happens, that chin tends to go underneath, and that when we're have that chin squished in, that we're seeing a little bit more of the baby's nose, and that's perfect. So we're looking, once he's latched on, that his lips are rolled forward, what we call duck lips, right, on the breast. You might even see his tongue out the side. It's very perfect. We're going to watch for that bottom chin to be moving. Sometimes hard to see, so we watch the ears, and then we're listening. Can we hear him swallow? Can we hear him breathing? So a couple things. One is he really needs to be feeding every 2 hours, and I would love to see him at the breast for at least 20 minutes. That can vary. So after this, I'll take a look at how long he feeds for, and then we can go from there. Does that make sense?
Yes, that's great.
Perfect. So if for some reason this is not working, I want you to know there is other options. We can talk about other ways of feeding baby, and if you want to avoid a bottle, and because sometimes we do feel like giving up, we can talk about syringe feeding. We can talk about, again, feeding with a spoon. A newborn baby can do that, and they can even drink from a cup.
Oh, wow.
Right? So I want you to know there's lots of options, and we're going to shoot for the breastfeeding. I'm going to give you a call later this evening and see how things are going. We could FaceTime, and I can watch you do a feed if needed.
That would be helpful.
And then I will be following up every day for a few days to make
Oh.
sure that things are going well for you.
Thank you. Oh, nice.
Okay, thank you so much, Kendra. And I need to get going. Do you have any other questions?
I just want to make sure that he's peeing and pooping enough.
Oh, yeah. So,
So-
how many pee and poop diapers in the last 24?
Right now it's 4 pees and he's doing at least 3 poops.
Oh, that's
Sometimes
perfect.
more. Okay,
That
good.
is perfect.
Yay.
So what we would expect is tomorrow that he should have 5 pee diapers.
Okay, got it.
And then the equivalent, as many, at least if he's pooping once, he's doing
Okay,
great.
okay.
But breast milk does have a laxative, so that helps him have lots of bowel movements.
Oh, wow.
But he's right on target in so many ways, and I'm very proud of you. You're doing
Oh.
such a good job.